A bigger round of applause for her, please. Thank you. Thank you, madam.
Thank you so much, Mr. Ademola. Thank you so much. Let me start by acknowledging the representative of His Excellency, the Governor of Kwara State, the hometown of the author. You are most welcome. And I'm happy that it is a young man who I always watch on the TV, very active and vibrant. And I said, yes, these are the leaders we need for the future of Nigeria. Honorable Shagaya, I'm seeing you for the first time physically, but I've watched you and some of your colleagues that are doing a great job in the National Assembly. You are most welcome. I also welcome the representative, another young man, Dr. Murtala. I learned he's on his way coming, represented the governor of Niger State. You are welcome. We also have the representative of the Honor Coordinating Minister of Health. You are most welcome. Our royal fathers that are here today with us, the Emir of Lafiagi, and also our own professional Emir, the Emir of Shonga. You are welcome, sir. Our distinguished senator, and I must mention His Excellency, Senator Olorigbe, the chair of the National Health Insurance, who have been in the health sector development for a very long time. And he's never tired, he's still on it. The chair of the Pharmaceutical Society Council, Hajia Pharmacist Giwa, she's also here with us. We have my own dear sister and my very good friend, the registrar, Nigerian Medical and Dental Council, Dr. Fatima Kyari. People call her an iron lady, but she wants to get it right. Please bear with us. Former Attorney General Mohammed Adoke. My boss is here also when I started my journey in the health sector in FCT. Dr. Mohammed, you are most welcome. Nice to see you. My brother, Dr. Ado. Jay, you are welcome. Ado Mohammed. And everybody, too much to mention, because this is actually our space. So, Alhamdulillah, to Almighty Allah be the glory. And all distinguished guests, ladies and gentlemen, it is my great pleasure to welcome you to this very important national gathering. It is a national gathering, but the difference is not organized by a government person. It's organized by an individual who is very passionate, who has been in the system, is not in the system, but continue to contribute to the development of the health system. And that is the author, my own dear brother, my colleague, my professional colleague, and also a friend, Dr. Abdullahi Jibril Mohammed. The gathering is to launch Trust Renewal, the integrity call for better health for all. It is an initiative for health accountability and transparency. This book comes at a critical moment in Nigeria's health sector development, as we all know, under the leadership of His Excellency, President Bola Ahmed Tinubu. We are advancing important reforms aimed at strengthening our health system, improving access to quality health care to all Nigerians, expanding coverage, and enhancing service delivery. However, this work being done by Dr. Abdullahi rightly highlights the successes of these efforts depend not only on resources and policies. As we all know, Nigerians, we are very good in putting together policies and also frameworks and policy directions. But fundamentally, it has to be based on trust. Distinguished ladies and gentlemen, trust is the foundation upon which effective health systems are built. It influences whether people seek health care, whether they utilize the health care, whether they adhere to their treatment guidelines or whether they engage with the health systems. Without trust, even the most well-designed intervention may fail to achieve their intended impact. So this is coming at the right time to look differently out of what we have been doing in the past. You know, we always give, but we don't reflect on who is the receiver. What are their feelings about what we give them? What are their own perspectives? And I truly appreciate the book, the author of this book, for bringing those perspectives. I also welcome one of our great mentors, our boss, Dr. Shehu Sule, who is just coming in. You are most welcome, sir. So it reminds us that the true test of our health systems lies in the lived experiences of our people. The patient journey, where care is delivered with dignity. Care must be delivered with dignity. So we are looking at, do we truly deliver care with dignity? Our professional attitudes. We've all talked about attitudes of health workers to our patients. Have we done much in terms of that? And also the responses of our patients to us. How much do we generate those responses and deploy those responses into the way that we continue to do things? This is why the focus of this book, integrity and accountability, are both timely and essential. It is also where it tells us, apart from dignity, justice and fairness in delivery of healthcare, or undermined by gaps in responsiveness and accountability. There is no doubt healthcare is about life saving. It's either you save life or you don't save life. And that is why truly the measure of accountability is very clear and glaring. As long as you don't deliver, you don't save lives. You don't improve the quality of lives. And it becomes very clear. There's no hide and seek in that game. The emphasis on patient care is particularly important. A responsive and people-oriented health system must listen, learn, and act on the experiences of those it serves. Patient feedback is not merely a complaint mechanism, as most of us believe. You know, the attitude, unfortunately, of most of us is once you get a feedback from your subordinate, you feel they are just complaining. This is not possible. This is not the way when it comes to healthcare delivery. It's not a complaint, but it helps us to get the insight for improving quality, strengthening accountability, and restoring confidence. It helps to address challenges so that we also, it's not always complaint, sometimes it's also appreciation of what has been done that is good. And if we don't get those feedback, we will not be able also to sustain some of the great lessons, the good work that we are doing. So it helps us document best practices, also share knowledge for replication nationwide. So as we continue to implement national health sector reforms, including the drive towards achieving universal healthcare coverage, where we are aiming to ensure that no one is left behind. No population is left behind, especially vulnerable population, which still constitute the significant gaps that is confronting the nation. And those are women of reproductive age group, children under 5 years, adolescents, the elderly people. Now the elderly people are above 65, some above 75, but they are still very productive. And the poorest of the poor, as well as even the disabled people. So those we must make sure that are well covered and their voices are heard. We must ensure that integrity and trust are deliberately built in our systems. We must do things differently. This requires strong governance, effective regulation, transparent processes, and a culture of professionalism and ethical practice. Distinguished ladies and gentlemen, our royal fathers that are here with us today, especially the royal fathers, You are closest to the people. You hear the voices of the people much more than we hear. So we would like you to escalate those voices. We want to have a reflection, as this book not only provides reflection, but also a practical framework to guide this effort. It is a valuable contribution to ongoing national dialogue on health system strengthening. Let me again commend the efforts of the author, Dr. Abdullahi Jibril Mohammed, an expert with track record of excellence in health system strengthening, especially at the primary health care level. And it is still our desire, our quest to achieve universal health care coverage. He strongly believes it is possible, it is doable, and we are happy you are bringing this perspective, bringing forward voices, for bringing forward voices and experiences that are often not heard, that are often neglected. We are only given, we are only taken to improve what we are doing from the voices of our patients and also our clients at the facility level. These insights are critical for shaping a health system that truly serves the people. As we begin today's program, I encourage all of us to engage actively, reflect deeply, in a very transparent manner, and commit to translating this insight into action. I strongly recommend this book to everyone, especially our health workers, our students, those that desire to also become health workers, our programmers, our policy makers, and all, including our legislators, to read this book. We can together have a health system that is stronger, not just stronger, but most trusted, accountable, and responsive. Because indeed, better health begins with trust. So trust is a critical component of delivery of healthcare. I want to thank you all. And with these few words, I declare this very important event open. Thank you so much.
Thank you very much, Mel. Let's put our hands together for her. Better health begins with trust, and without trust, the most intended intention may fail. Another round of applause for her, please. Thank you so much, Ma, for setting the compass for today's conversation. Thank you, thank you. While she was giving our opening speech, she recognized some of our distinguished guests that are here, but I also would like to also recognize some that are here. Dr. Ado J.D. is the Director of Health Social Protection. Let's put our hands together for him. Thank you so much, sir, for coming. Also, we want to recognize Dr. Shehu Sule. Thank you so much, sir, for coming. Also, we want to recognize Hajia Wasilat Gia, Chairman, Pharmaceutical Council of Nigeria. Thank you, ma'am, for being here. As the programs progresses, we'll keep on making the recognition. Behind every powerful book is a burden, a question that refuses to let the writer sleep. For Dr. Abdullahi Jibril Mohammed, that question was, and is still simple: can we have health for all without integrity for all? Big question, begging for answer. So to answer and to share why Trust Renewal had to be written, let me invite to the podium the author himself, Dr. Abdullahi Jibril Mohammed, to tell us why Trust Renewal matters in the health sector. Let's put our hands together for the man of the moment. Thank you so much, Doctor. Another round of applause for him, please. Let's keep clapping until he comes. Thank you so much, sir.
Well, I want to abridge the protocol, just in line with the last speaker. representative of His Excellency, the Governor of Kwara State, the Chairman of Governors Forum, my own governor, representative of the Honorable Minister of Health, Professor Muhammad Ali Pate, Dr. Owe, my friend, distinguished royal fathers, distinguished ladies and gentlemen. I'm highly honored to stand before you as the author of the book to share the explorations that I've shared in the book. For nearly 4 decades, I served in diverse roles within the health system, each expanding my perspective and deepening my understanding of the multiple dimensions that shape healthcare delivery. My public service journey at the National Primary Healthcare afforded me the rare privilege of working with the Honorable Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, who served as my Executive Director, and also with His Royal Highness, the Emir of Shunga, Dr. Haliru Danusayaya, who chaired the governing body. And he also graciously authored the foreword of this book. This opportunity provided invaluable mentorship under these distinguished leaders. Beyond this, my work as a health system consultant provided a truly holistic lens, one that bridges the formal structures that govern healthcare delivery with the lived experiences of communities, frontline providers, and patients they care for. It is this dual perspective that continues to shape my commitment to health system that is not only efficient, but is compassionate and responsive. Along this journey, I witnessed significant investments in infrastructure, in workforce, and programs. Yet, I have observed a troubling reality in the health system: integrity crisis and the erosion of trust. This led me to a simple but profound realization. Health systems do not succeed simply because they have infrastructure, because they have human resources, because they have technology, because they have policies, both policy and legislative framework. They succeed or fail along the patient path. It is along this path, from seeking care to outcomes in illness, that trust is built or broken, that integrity is either upheld or compromised. In my work on regulatory compliance and complaints management system, I encountered recurring patterns that expose significant and sometimes uncomfortable truth about our health system. These insights inspired the creation of patient management and communication platforms, which was a private initiative. The Trust Renewal podcast and Trust blogs, and also an electronic platform, what I tagged Patients Independent Feedback Channel, that was designed to give patients a safe and independent voice. Through these platforms, we began to systematically collect, and analyze patients' lived experiences. From these raw accounts emerged a clear and consistent insight into the realities many Nigerians face along the patient journey. These findings were gathered, they were examined, and they were articulated in the book we are launching today, Trust Renewal, the Integrity Call for Better Health. These experiences pointed to troubling and recurring patterns, which includes infringement of patients' rights, absence of voice, ineffective complaints management system, professional and ethical lapses, and broader accountability deficits in the health service. These are not isolated. they are systemic. They undermine integrity, they erode trust, they weaken public confidence in the health system, they discourage timely health seeking by citizens, they promote reliance on unregulated and inferior alternatives, they drive citizens towards unsafe and substandard options. They drive citizens into arms of foreign hospitals, forced to spend their life savings. It is not born out of choice or luxury. It is medical exile. It is a deliberate escape from a system that is affected by accountability deficits. Most importantly, all those things I mentioned now jeopardize our national health outcomes. But they also provided something powerful. And what they provided is evidence for action. That evidence for action is in this book we are presenting today. It is a public interest work dedicated as a public good, grounded in patients' lived experiences to advance trust, integrity, and better health for all Nigerians. Distinguished guests, in strengthening our health system, we have focused largely on visible items. This includes buildings, equipment, workforce, and financing. These are essential, but they are the hardware of the health system. But the results are not always matched with these investments, because a health system is not only built, the health system is experienced. And that experience is shaped by the software. And what are these software? The software includes the trust, the integrity, the accountability, the leadership, and also how patients are treated. This software determines whether investments deliver value or are undermined. A well-equipped hospital that ignores patients is a failing system. A modest hospital that treats patients with dignity can build trust and deliver better health for Nigerians. This is the central message of this book. Hardware builds capacity. Software drives performance. And trust is the bridge that binds the two. At its core, better health begins with trust. And trust is built on integrity. Integrity determines whether care is fair, whether the system responds to people's needs, and whether data is credible. This book is therefore not just a reflection. It is a call to action. To government, to strengthen governance and accountability. To professionals, to uphold ethics and duty of care. To institutions, to listen, to respond, and also to improve service. And to citizens, to speak, to engage, and demand for better care. Restoring trust is our collective responsibility. As we launch this book, let it mark the beginning of movement to patients, to put patients or place patients at the center of care, to strengthen accountability and restore dignity in every encounter in health service. It is important to note that we all walk the patient's path, whether as a patient ourselves or as loved ones or as caregivers. Let this work guide policy. Let this work inform practice. Let this work inspire reform. Together, let's turn insight into action and action into lasting change. Let Trust Renewal not end as a publication in our bookshelves, but as a beginning of national consensus and collective movement to restore integrity, to renew trust, and to rebuild a health system worthy of our people. Following the launch, we'll partner strategically with stakeholders to strengthen accountability, to rebuild trust, and to improve health system performance and outcomes. Key activities will include public enlightenment, targeted training for health workers and workforce, using the book as a core resource to drive measurable change. I urge all the partners, institutions, and citizens to join hands in this endeavor, recognizing that integrity is the foundation of trust, And trust is the lifeline of a resilient health system. Together, we can build the resilient structures that uphold integrity and foster trust for generations to come. Because in the end, better health truly begins with trust. Distinguished ladies and gentlemen, I sincerely appreciate you for your time, for being here, and also for listening to me.
Awesome, awesome. Thank you so much, the author. A bigger round of applause for him, please. Integrity is the foundation of trust. A bigger round of applause for him, please. He has just told us that the pen is mightier than the sword. And today, the author has prescribed integrity and trust for all. Thank you so much, Dr. Jibril Mohammed. Thank you. Your Excellencies, here represented honorable ministers, your Royal Highnesses, distinguished guests, ladies and gentlemen. Where we're moving forward now, a book is reviewed not just to praise it, but to prove it. So to test the weight in the real world of policy, politics, and patience. To do that, we have a man who has sat on both sides of the table. He's been a legislature and also in the regulation. Please welcome Dr. Ibrahim Yahya Oloriegbe, former chairman, Senate Committee on Health, and former chairman, National Health Insurance Authority, to review Trust Renewal Integrity as Foundation for Health for All. Let's put hands together for him, please.
A senator, and once a senator, always a senator.
Okay, a senator, always a senator. Apologies, sir.
Thank you very much.
Okay, you can have this, sir.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وصلى الله على سيدنا محمد وعلى آله وصحبه وسلم. I will distort the protocol by recognizing their Royal Highnesses first. Royal Highnesses, because the representative of the governor, representative of coordinating ministers, very many senior colleagues here. I will say Dr. Shehu Sule represented all the senior colleagues that are here. And Aja Wasila also represented the other senior colleagues. Distinguished ladies and gentlemen, I will have just said thank you to everybody because the author has also, in one way or the other, reviewed the book. But I've been given an assignment and I must accept it. The author is my classmate since 1979. So that's about 46 years ago that we have been together in the SBS in Zaria and through the 5 years of medical school, and we have continuously continued to engage. On a lighter mode, I recall we always compete in those days in medical school. But competition positively in terms of when we read, when we do exams, we look at who will score higher, who score. So we thank God for His mercies for us to be here today. So let me start by congratulating him for putting this book together. As a student of health system, when I got the book and I started reading it, for many years we read the WHO building blocks of health system, expanded through, it is the 6 building blocks, but when we were developing the Nigerian health policy and health sector reform, we expanded it to include, to bring out specifically community as a specific building block because of the importance of community. That's why when I was trying to start my protocol, I started with the Royal Highnesses because community is very critical and important. Now, this book, Trust Renewal, therefore, is a timely intervention and a necessary reset. Trust Renewal examines Nigeria's health system through the lens of a trust deficit rooted in weaknesses of integrity, governance, and service delivery. Rather than focusing solely on infrastructure, financing, human resources, policies, supplies, and so on, as I said, which are the key building blocks that we all understood before, It elevates integrity, accountability, and patient experience as the essential drivers of system performance. Drawing on real patient experiences, the book shows how everyday failures, ethical lapses, weak regulation, poor responsiveness, and ineffective feedback system erode confidence and undermine outcomes. It advances a bold idea: trust is not a byproduct of healthcare performance, it is a driver of it. Through a structural reform pathway, it offers practical solutions to embed trust into health system design and implementation. When we have the book, by the time the book is unveiled, we see that it has 11 different sections, which I will not read. I want you to go and read that in the book. Now, the Trust Renewal, the integrity call for better health for all. One, is a definitive blueprint for rebuilding trust in healthcare. The book, Trust Renewal, the integrity call for better health for all, stands as a landmark contribution to health system reform discourse in Nigeria, offering not just diagnosis, but a structural pathway for restoring trust through integrity-driven governance. With a carefully organized four-part structure, Dr. Abdullahi Jibril Mohammed moves beyond abstract advocacy to deliver a comprehensive system-wide interrogation of healthcare failures and a clear roadmap for renewal. The book arrives at a defining moment in Nigeria's system journey, where reforms are advancing, just like the essay to the president said, where investment are increasing and expectations are rising, yet public confidence remains fragile. Across the country, citizens continue to approach healthcare with uncertainty, questioning the quality, questioning the fairness, questioning the responsiveness and accountability of services. This presents a clinical paradox. We are strengthening system, yet struggling to sustain trust. The trust deficit we face today is both a warning and an opportunity. It signals deep systemic challenges, but also presents a moment for transformation, a chance to rebuild stronger, more resilient bond between people, institutions, and society. Trust renewal is therefore both timely intervention and a necessary reset, confronting a central but often overlooked truth. Without trust, even the best designed health system will underperform. Let me highlight why Trust Renewal Trust stand out among leadership books. There are few books that talk about trust in healthcare, but fewer capture both its intellectual complexity and its emotional force. Trust Renewal succeeds because it does both. That is this book. Unlike works that reduce trust to motivational slogan or quick fixes, this book offers conceptual depth, a clear framework for understanding how trust is built, how trust is broken, and rebuilt across personal, organizational, and societal levels. It treats trust as a serious discipline rather than a soft skill. At the same time, its narrative power makes those ideas unforgettable. Through vivid case studies and compelling storytelling, the book transforms abstract theory into lived experiences, showing readers not just why trust matters, but how it can be renewed in practice. This dual strength, rigorous analysis, paired with engaging narrative, sets Trust Renewal apart from other trust texts. It is not just a guide for stakeholders, but a profound reflection on the human capacity to restore the bonds that hold communities and organizations together. The crisis of trust deficit. The core challenge addressed in Trust Renewal is not merely infrastructure gaps or financing constraints or shortage of human resources or shortage of supply. It is the erosion of integrity across healthcare journey. This erosion manifests in multiple everyday realities within the system. Patient experiences disrespect, experiences delay, and exclusion in care delivery. Absenteeism and poor provider availability disrupt continuity of care and deny timely access. Informal payments and non-official charges undermine fairness and equity. Conflict of interest distort clinical decisions and compromise patient welfare. I'm very happy that we have the MDCN and the PCN, who are the regulators of the major professionals here. I hope we have the nursing registrar also, because it's important about the professionals and their practices. Professional misconduct and ethical failures weaken standards and accountability. The presence of unsafe and unregulated practices, that is unsafe, and exposes patients to avoidable harm. Fragile or non-existent feedback and grievances system silence patients and limit redress. Weak and delay emergency care response turn critical situations into preventable tragedies. Weak accountability mechanisms allow this failure to persist without consequence. As these experiences accumulate, citizens lose confidence in the system and service utilization decline, not necessarily because services are not available, but because they are not trusted. Trust as the engine of health system performance. At the heart of Trust Renewal is a transformative and disruptive proposition. That is, trust is not a byproduct of healthcare performance, it is a driver of it. This reaffirming shifts trust from a passive outcome to an active system input, one that directly shapes how people engage with healthcare, how providers deliver care, and how systems perform. What does this mean in practice? When trust is present, patients seek care early, they adhere to treatment, and remain engaged. This is very critical for our country. Just like the author said, many of our citizens go abroad not because they wanted to, but because there's no trust in the system that we have here. Many women, many children, what we used to know is that, people delay to go to the hospital to go and deliver, women who are in labor. Part of which is because when they get to the facilities, they don't trust the system there. Providers act with professional integrity and accountability. Communities cooperate with public health intervention. Systems achieve better utilization, outcomes, and legitimacy. But when the trust is absent, therefore, patients delay or avoid care, informal alternatives and unsafe practices thrive. That is why many of our people, because they trust the traditional system, where they will either give chicken or whatever, or delay payment, but whereas it is what I'll call crook, and it is not permanent. But because the former system is not trusted, that is what happened. Compliance with treatment and prevention decline. Even well-funded intervention fail to deliver impact. Trust, therefore, is not peripheral. It is foundational to performance. This book advances a set of powerful reframing. One, integrity as a governance innovation. Integrity is repositioned as a functional tool of governance, one that enables transparency, accountability, and responsiveness. It is not abstract, it is designed, implemented, and monitored. Patient experience as a performance indicator. One of the book's most compelling, strength lies in its integration of 173 real-life case studies drawn directly from patient lived experience. These narratives highlight that patient experience is among the most powerful drivers of trust, a force that not only upholds integrity, but also enhances the overall performance of the health system. These cases are not incidental, they form the foundation of the book, grounding its argument in reality and giving voice to the everyday encounters where trust is either built or trust is broken. The book elevates patients' lived experiences, respect, dignity, communication, timeliness, from soft issue to core metrics of quality and system effectiveness. The book moved from moral appeal to system reform. Traditionally, discussions on ethics and integrity in healthcare have been framed as professional or moral obligations. Trust Renewal goes further. It presents integrity as a design principle for health system, a performance variable to be monitored, a policy priority to be institutionalized. This shifts the conversation from healthcare workers should be ethical to health system must be designed to produce and sustain ethical, accountable behavior. This is very important and critical Because before, what we always look at is that the health worker should be ethical, they should do well, but it's the system that we have to look at as a whole, because we want to build trust. The contextual significance of this is that the state of integrity and trust. Nigeria's health system is marked by a fragile state of integrity and deep trust deficit, weak accountability, structures, inconsistent enforcement of standard, and frequent breaches of patient rights have eroded public confidence. Restoring integrity and rebuilding trust is therefore not optional. It is cornerstone for improving service utilization and achieving meaningful healthcare transformation. Continued health system reform is what I want to talk about. There are continued health sector reform that signal a bold vision for transformation. This includes advancing universal health coverage, coordinating under sector-wide approach, driving change through national health sector reform implementation initiative. Yet, the true measure of success will not rest on policy design or resource allocation alone. It will depend on whether this reform renew trust at the point of care. Without trust that health services will be available, respectful, and accountable, no matter how extensive the reforms or how much is invested, utilization of health services will remain suboptimal. We have to look at the legal environment and the policy framework. Nigeria already has strong legal and policy framework designed to improve responsiveness. The National Health Act 2014 guarantees patient right to information, right to consent, confidentiality, and accountability in financing and governance. We have patient bills of rights, which affirm entitlement to respectful, non-discriminatory care, timely access, informed consent, and grievances redress. We have SAFICOM, which is a frontline mechanism that operationalizes patient rights, enforces service standards, and strengthens accountability in health facilities. Yet, persistent reality gaps reveal failures of implementation and enforcement. I was this morning on NTA discussing this, that we have all these policies, but implementation at the front line or at our encounters with various services has been a failure in this country. Patients arrive at facilities only to find providers absent. Women in labor are asked for informal payment before treatment. Care is delivered without explanation or consent. Complaints are ignored due to weak grievance system. Emergencies are delayed for lack of police report or upfront payment. Patients turn to unregulated providers out of mistrust in formal facilities. These are not isolated incidents. They reflect a systemic disconnect between policies, intentions, and lived experiences. They remind us that reform and legislative framework, while necessary, are not sufficient. For every patient to experience a fair, responsive, and trustworthy health system, Trust Renewal must be placed at the heart of Nigerians' health transformation agenda. Let me move to the target audience of this book. This is a national multi-stakeholder call to action. The book is speaking to policymakers and government leaders. It's speaking to regulators and professional bodies. It's speaking to healthcare providers. It's speaking to development partners, speaking to civil societies, speaking to communities, and as well as speaking to the patient, who are the ultimate focus of any health system. Each has a role in building, protecting, and sustaining trust. This book fills some gaps. While reform discourses has focused on financing, infrastructure, technology, supply, and so on and so forth, this book brings attention to what is often neglected: integrity in practice, patient life experiences, trust as a system performance variable. It bridges this gap by linking ethics, governance, and service delivery, and by offering a practical accountability framework. The book also advances thinking and practice. The book shifts the central question from how do we build a system to how do we build systems that people trust. It advances practice by elevating integrity as a core performance pillar and standardizing feedback and grievances system. It emphasizes data integrity, leadership, and culture, and it's providing a roadmap for embedding trust in system design. What should stakeholders do differently? The book makes the following recommendation. Make trust a core performance indicator, institutionalize patient feedback and grievance redress system, strengthen regulatory enforcement and ethical standard, promote transparency in financing and service delivery, invest in leadership, culture, and accountability system, prioritize patient experience alongside medical outcomes. The book has 4 parts, and I will just summarize that because of time. The foundation of healthcare integrity. The book defines the principle of trust, patient rights, accountability, and primary healthcare as the system foundation. It establishes what a trustworthy system should look like. Then part 2 is the integrity failure at the point of care. The book exposes how failures occur in real patient encounter, misconduct, informal payment, silence of patient voice, weak emergency. It shows where trust is broken at the point of care. The part 3 of the book is systems, regulation, and structural failures. Diagnosis, the book diagnoses root causes, weak regulation, inequities, workforce disruption, poor data integrity, and leadership gap. It outlines different infractions and explains why failure persists. In part 4, the book explains how do we rebuild trust and design the future. It provides a roadmap, system design, leadership accountability, and collective action. It shows how trust can rebuild deliberately and sustainably. Then the book went further. What future direction for consolidating? Okay, this is my own view. It's about future direction for consolidating trust renewal. Trust renewal, the integrity core for better health for all, powerfully examines Nigeria's system through the lens of trust deficit, linked to weaknesses in integrity, governance, and service delivery practices, and position trust as central to performance. While its conceptual depth and narrative power are strong, its impact could be further enhanced by the following additions. To strengthen its operational impact, future work will incorporate the following: measurable trust indicators. Because if you don't measure something, you cannot act on it. So we need the book in future should look at that, because the framework has been defined, have been designed and defined, and we have identified the problem. So we should know how do we measure that. The second one is comparative global insight. So because we are not operating in isolation, and implementation case studies and deeper analysis of the political economy dynamics. Political economy is always very important. We know when we design program, we have to look at some of the trust that we are seeing in the deficit. Are they related to certain things within the culture, within the economy? Because sometimes you cannot change a system because it's based on how people feel, how they look, how they think. So those are political economy. Then the other last thing is that the world is changing. What will be the effect or impact of AI? To either reduce or will it increase this deficit? Because the future of health and of everything is AI. As much as we, because the interface between human, in terms of services, about human being there, is going to be reducing. Will that help us to be able to address some of these trust issues? And I have a very good examples because of time. In NHI, as part of one of the disciplinary actions that we took as a board was they brought to us issue of staff who collects premium from people, but instead of paying that premium to the account, what they did is to look at the formal sector and change people's name. So it was very, very, very troublesome. But when as board, when I look at this, what we said is that what happened is because of the technology. The technology is not foolproofing. Because the technology ought to have been there to prevent you from changing somebody. That's why now they introduced a name. Because before, everybody does have their names. So it can be Ibrahim Yahya, then Yahya Ibrahim. It's still see me, but it's just me bearing two names, but it's me. But if it's name, Ibrahim Yahya will have only one single name. Whereas Yahya Ibrahim's name will be different because there's capture. So that's what I'm trying to say. With technology, such kind of things can be. That's why I talk, but there are much more like that. That's why I try to underscore this, that we need to, in future, to look at what will be the effect or the impact of the AI in reducing that. And I'm going to my final statement. Final passage and reflection from insight to transformation. Across its 4 parts, the book progresses with clarity. Define integrity, it exposes failure, diagnose causes, design solutions. This is not a book structure, it is a reform path. Trust Renewal is more than a book. It is a system thinking blueprint and a national call to action. It reminds us all that every reform, every policy, every investment must answer one question. Can people trust the system? Better health begins with trust, and trust must be designed into the system, protected by accountability, and sustained through collective responsibility. Thank you for listening.
Thank you very much, Senator. Let's put our hands together. Better health begins with trust. Okay.
I saw my brother. He's hiding there. Distinguished Senator Sadiq. I think he should come to the front. Thank you very much.
All right. Thank you so much, Senator. Thank you for that elaborate diagnosis of the book. Let's put our hands together for him once again. So let me just formally welcome Senator Abubakar Sadiq, Senator representing Kwara North. Let's put our hands together for him, please. All right, thank you. Thank you. All right, thank you so much. Thank you so much, Senator Dr. Ibrahim Oloriagbe, for that elaborate diagnosis of the book. Thank you. Your Excellencies, Honorable Minister, Your Royal Highnesses, distinguished ladies and gentlemen, the best way to find yourself is to lose yourself in the service of others. That's saying from Mahatma Gandhi. This is also the core of this public health book. Now, to deliver the keynote address and connect this book to Nigeria's health agenda, we are honored to have the representative of the Honorable Minister and Coordinating Minister of Health, who is here represented by Dr. Ogbe. Let's put our hands together as he comes forward. A bigger round of applause for him, please. Thank you.
Thank you, sir. Thank you. His Excellency, the Executive Governor of Kwara State, ably represented by Honorable Shagaya, His Excellency, the Governor of Niger State, I believe is to be represented, the Special Advisor to His Excellency, Mr. President, our own very mommy here in the room, grateful for your presence, His Royal Highnesses, distinguished Royal Highnesses, the Emir of Shonga and the Emir of Lashagi, thank you, and distinguished senators here present in the room, Senator Lorubrea and his able colleague, the chair of the National Health Insurance Authority, the Registrar, Medical and Dental Council of Nigeria, distinguished ladies and gentlemen, senior colleagues, so Dr. Ado, the SA to DG Budget, and the SA to the Honorable Coordinating Minister of Health seated. Good morning. My name is Dr. Ogbe Orishewemi. I am a special advisor to the Honorable Coordinating Minister of Health. I will start first by rendering his profound apologies. Dr. Shehu, sir, pleasure to see you. His profound apologies for not being here, exigency of duties. But I do know he has been engaging with Dr. Abdullahi on this book for a couple of weeks now, and he had made plans to be here. He has asked that I represent him and try my best to convey and fit in his gigantic shoes his message to this gathering as we look forward together to build trust, better trust in the Nigerian health system. So with that, I will stand on all other established protocols. Your Excellencies, distinguished guests, development partners, leaders of our health institutions, ladies and gentlemen. It is indeed the pleasure of the Honorable Minister to be presented here today at the launch of Trust Renewal, the integrity call for better health for all. I am particularly pleased as it is going on at a time when the Federal Ministry of Health is renewing our focus on the critical issue of quality, which is indeed the foundation of trust within our health system. I wish to start by thanking Dr. Abdullahi Mohammed Jibril, the Octor, whom I know very well for many years, for your unique resource addition to the national discourse. When we started the journey to reshape our health system in 2023 and undertake necessary reforms under the leadership of the President Bola Ahmed Tinubu as an integral part of the Renew Hope agenda, there was a clear understanding that one of the fundamental challenges to be tackled was the lack of trust within our health system at the various levels. In recognition of the need for all stakeholders and actors to be on board from the start of the reform journey, Mr. President in 2023 signed a health compact with His Excellencies, the executive governors of all states. This compact is the foundation which the 4 pillars of the Nigerian Health Sector Renewal Investment Initiative are built. The initiative has helped us shift from vertical and fragmented projects to a more coordinated, result-driven investment in our health systems using the sector-wide approach SWAP. This enables us to have one budget, one plan, one conversation, and one report among governments and our partners, and thereby strengthen accountability, which serves as the core basis of trust. Central to the Nigerian Health Sector Renewal Initiative is Pillar 2, which focuses on efficient, equitable, and quality health systems, with actions that focus on improving the quality of health services across all levels of the system. While Dr. Abdullahi in his book has successfully crafted the novel concept of trust being the invisible infrastructure on which healthcare systems are built, with significant and consequential impact on both actual and perceived outcomes in our health service delivery, I think it is pertinent to also view from the perspective that the development of trust is based on both actions and inactions that occur within the health system in real terms. It is the actions that people perceive and people receive when they attend the health system, or the failure of those actions that determine the level of trust that they will have on the health system. And it is based on this that the fundamental building blocks of human resources, infrastructure, financial access, quality, data, and logistics systems that ensure availability of essential commodities, amongst others, are critical as the platform on which we will build trust. It is to address this and to ensure that people are able to take early decisions to seek care, utilize services, and comply with care directives, and ultimately improve the quality of care, that we consider trust, as proposed in the book, the new addition of our health systems building blocks in Nigeria. So Senator Olorugbe talked about the 6 and now expanded 7 building blocks, and I think we can, going from this room, begin to look at trust as an additional building block that which we must build to improve our health system in Nigeria. To enable a veritable platform, enable the establishment of a veritable platform to enable our health systems take on the cloth of trust, significant achievements have been made in our building blocks. By the close of the first quarter of the year, the federal government, working with the states, Your Excellencies, and partners, and most of the actors here in this room, have been able to achieve some of the following. We have successfully established a maternal mortality reduction initiative, MAMI, which is being operated in 172 targeted LGAs and now expanding across 33 states to address the source of over 55% of our maternal deaths in the country. Through this initiative, we have so far been able to modestly reduce maternal mortalities in those localities by about 21%. Infrastructure-wise, over 2,583 PSC centers have been revitalized to improve access and quality of care at the front lines, while others are ongoing. Well over 1,600 are also ongoing. At the secondary and tertiary level, 262 comprehensive health centers, comprehensive emergency obstetrics and newborn facilities have been empaneled under the NHIA, and are providing free cesarean sessions to our women in need. On the human resource front, we have deployed an additional 19,000 skilled birth attendants across 19 states, significantly improving the use of antenatal care services and increasing deliveries that are attended to by skilled birth attendants by 24.4% across the last few months. We have also retrained a total of 78,000 health workers across the country, including building those critical skills that promotes trust when they engage with our patients. Financial access is improving, though there's room for much more improvement, with over 21 million Nigerians now covered to receive care at no cost at the point of service delivery, with the Basic Care Provision Fund driving this process at the community level, and also improving our emergency transportation of our women to seek care. Efforts are also being made to ensure the availability of essential medicines in the front lines, with about 1.2 women so far receiving 20 of the prioritized maternal and newborn commodities, amongst others. Recently, the Honorable Coordinating Minister, has established the National Task Force on Clinical Governance and Patient Safety at the Ministry of Health. This has been fundamental to evolve strategies and implementable actions that will address the persisting challenges across the health system, and by extension, of course, improve trust. Since trust, as we have heard even this morning, is based on integrity and accountability, I think it suffices to also mention that right at the start of the administration, the minister entered an MOU with the Independent Corrupt Practices Commission to, on their own, repeatedly and continuously, continue to assess the health sector for gaps, to bring these gaps to the notice of the Ministry of Health, and to see that these gaps are adequately addressed to improve integrity and accountability. These efforts, amongst others, are already yielding the required dividends with an over fourfold increase in utilization at the primary health care level, indicative of a refound and growing trust of our health system. As we continue this initiative alongside our efforts to improve epidemic security and response to climatic issues, we envisage the emergence of a resilient health system in the coming months that would form the veritable platform for consolidation of citizen trust in our health systems. The book being launched today could not have come at a more opportune time, as it already lays out a roadmap we can all reflect on, and this has been done by both the author and Senator Olorugbe, and used as a basis to pursue necessary strategies to continue to build the cloth of trust across our health system. To do this, we need the unrelenting commitment of our communities, led by our most distinguished and respected royal fathers here present, and our LGAs and other community-based organizations, who must remain vigilant and guide the fundamental investments that are being made across the health system by both the federal, the state government, and our partners, particularly through the Basic Care Provision Fund, so that those investments on which trust can be built can remain steadfast, and we can continue to be accountable to Nigerians. However, most important to engendering trust is how our health workers provide care to citizens when they seek care. We acknowledge, and the Honorable Minister would like the Registrar of the Nigerian Medical and Dental Council to take this back to our health workers, that we acknowledge the immense sacrifice you put in daily to provide care to provide care in your work, and on the part of the federal government, as we work to continuously improve your welfare and provide the necessary tools and environment to deliver care safely. You must, however, remember that trust will not happen without you. Fundamental to trust are the health workers, and without them, we cannot achieve the trust that we are trying to achieve. To quote from excerpts of the book, every Nigerian at some point walks the patient path. In the journey, trust is tested. At the point of entry to the facility, in the interaction with health workers, in the transparency of cost and decisions, and the quality and safety of the care they receive. These moments are not defined by individual experiences, but also the credibility of the entire health system. You would agree that through this work, the health worker is the guide, the health worker is the umpire, and the most critical element to build trust. We therefore salute our health workers and thank them for all that they do as we continue to work together to improve the provision of respectful and patient-centered care. As a government, the Federal Ministry of Health will continue to build trust in a system by strengthening accountability mechanisms, improve service responsiveness, promote ethical conduct and professionalism, and continue to ensure transparency in financing and service delivery. We will work together with all stakeholders to elevate patient voice and feedback systems, promoting overall integrity in our healthcare system. Let me conclude by again commending Dr. Abdullahi for a job well done, and for once again reminding us that the health system is ultimately judged, like has been rightly said this morning, not by intentions, but by experiences. And with trust, we can exponentially improve our health service utilization and health outcomes. As we launch this book today, let us not relent in our commitment to building a system where our patients will receive dignity when they come for care, where every interaction will reflect the refound integrity in our health system, and every outcome will reinforce the confidence that Nigerians are beginning to slowly but surely regain in our health systems with renewed trust. Thank you, Dr. Abdullahi, for this work and this resource to the public discourse. Thank you, Your Excellencies and distinguished guests, and God bless the Federal Republic of Nigeria. Thank you very much for the opportunity.
Thank you very much, sir. Let's put hands together for Dr. Ogbe. He's a representative of the Honorable Minister and Coordinating Minister of Health. Thank you so much for letting us know the good work that the government is doing, especially in the health sector, addressing the challenges in the health sector, and invariably building trust in the health system in the country. Thank you. Let's put hands together for him once again. Your Excellency, the representative of the Kwara State Governor, representative of the Minister of Health, and also our royal fathers, distinguished guests, ladies and gentlemen. Well, we are going gradually. It is said that before we do the opening and the other thing, we're going to take the Goodwill messages. We're going to take Goodwill messages from, it takes a village to build a community. And for health, it takes a nation, lawmakers, royal fathers, medical elders, development partners, media, and civil society. You're in a very valuable time with us this morning. But first, let me call His Royal Highness, the Emir of Shanga, Dr. Haliru Yahaya. Please let's put our hands together for His Royal Highness as he comes to the podium to give his goodwill message. Please, a round of applause for him, please. Bigger, bigger, bigger round of applause, please. Your Royal Highness, sir. Thank you, sir. 3 minutes. Thank you, sir.
Excellencies here, distinguished elders, and let me just cut all protocols and move on. Time is of the essence. I have a written speech, but God forbid I read it here now, with the kind of pressure we have. Unfortunately, it's been summarized by all those who have come. Let me say something that strikes me very hard. They say I should talk as a traditional leader, that is, the community is in our care, and also talk as an elder. Snapshot, 70s, 20s in the new century, there's a difference. That difference seems to be what they're pointing out today. That ethics. And then the Ministry of Health is trying to make it a 7th block. I'll make it the mortar that puts the block together. That's the mortar. If you put it in between, or it sticks, and things go as a whole. That's my first observation. The other observation I have is, it's a very timely report. Timely because we've been plodding along. We're not looking at what's going on. We're not reflecting hard enough. But suddenly somebody, and I'm proud to say one thing extra here. All these people talking are from one family, Health Reform Foundation. Year 2000, both the author, the senator, all those talking, Dr. Sule, all from the same foundation. And the special advisor here. 2000, the WHO came out with a really damning report about Nigeria's health system. Where do we go from here? So an initiative was started. It was called Change Agents. So we became Change Agents, were funded by DFID, and started reforms. By 2 years later, we now transited into Health Reform Foundation and worked actively for 10 years. The new health policy, the new law, all these issues that are now running health came from that committee. They were presented to the House, they had to take ownership, that just be done. The health law took 10 years, and this Nigerian system did something to us. 10 years trying to pursue a health reform, and that is all history. So it's timely, because we've come at a time when you have a reformative government, really taking everything upside down, checking it and seeing how to move forward, and with eye on the indices. I think this is one area that this will contribute quite firmly. The other thing to say is that let us not miss the total picture. We are cutting through a diagonal slice of the Nigerian society. Whoever is in medicine came from that body. And if the ethics is low there, it's low here. Am I getting the point? Whatever you find in this, the engineers will say the same, the architects will say the same, and therefore something is more national that needs to be fixed. National orientation should be taken very, very seriously. Our values have drifted. And unless we can get the values restored, when the last Minister of Information was trying to set up a reorientation program, I went personally to him, who spoke for 1.5 hours. Of course, he came out with health, something begins with me. I said, it's not deep enough. He said, no, as it spreads along to be deeper. When this man was appointed NOA, I went to him personally and sat down and said, let us do something more profound. My friend Edie was also made NOA, but then he went into corruption and somebody hit him back. I said, yes, you went the wrong direction. When I started talking corruption, talk to 1, 2, they say, shut up there, and that was it. So something more gradual, and that's what the present NOA is doing. We need a national orientation. Values have shifted. So unless we get those things together, health will still have this problem. The other alternative is for Nigerian Medical Council, oh, she's gone, to try and, Fatima, to try and get us to have ethics as entry value to medical school. How you measure that, I don't know. So unless you do that, we have to take something more national. I think, in rounding up, I was going to say, congratulations, Hafon. You started the reforms, they are proceeding, and somewhere along the way, one very critical person of you has sat down and reviewed and said, there's something really missing. And he took information carefully, and now we have what we have now. Finally, we as community leaders here, Lafayette, you will have to say something, because the father of the guy who presented now. So I'm just giving privilege as medical elder to start first. So have fun, well done. Have fun, continue. Don't lose your steam. And I can see Oloregbe was one of our executive secretary, while I was chairman. The thing is still continuing. Dr. Sule is here. Finally, Nigeria, we have a problem. And I think the Ministry of Health has taken note, and we, the minister, is here, but we have spoken with him already. So over to you. Once again, congratulations for this rigorous academic cum social work you've done. It's profound. One thing I want to say as I see the Pharmacy Council here, when we put the patient at the center, that means clinically we want this person to get better. So I'm sorry to make these scathing remarks. I don't need a PhD to look after a clinical patient. I don't need a PhD in pharmacology, PhD in that. By all means, go and do your PhD in pharmacology, pharmacy, whatever. But start an institution, teach it. But inside the hospital, to reduce costs, we've got to cooperate around the doctor in the clinical setting. I'm sorry, I hope I'm not raising criticism, but this is the real focus. The patient is the focus. The doctor is the person. I'm going to the hospital to see my doctor. And everything there is peripheral, but not unimportant. But if you want to have academic qualification, yes, start your institution, go and lecture, be a professor in your institution that is teaching them. Sorry to start on the controversial note. Thank you very much.
A bigger round of applause for His Royal Highness, please. Thank you so much, sir. There is a need for a national reorientation concerning the health sector. Another big round of applause for His Royal Highness, the Emir of Shanghai. Thank you. Shanghai, okay. Shanghai, sorry. Apologies. I just remember, when we did history in school, Mansa Musa, Shanghai Empire. Oh, no, this is Shanghai. Thank you so much. Apologies, sir. Thank you so much. There's need for a national reorientation on the health sector. Now, we're not going to call on Senator Abubakar Sadiq, Senator representing Kwara North, to please come forward. Yes, Sadiq, Senator, please come forward. Let's put our hands together. He give his goodwill message for just 3 minutes. 3 minutes, please. Let's keep clapping until he gets here, please. Thank you. Senator, sir.
Thank you very much. Auzubillahi minash shaitani rajim. Bismillahir Rahmanir Rahim. The Governor of Kwara State, Mala Brahma Abdurazak, were represented by my brother, Honorable Mukhtar. Our royal fathers, our leaders present here, please allow me to stand on the existing protocol. Let me first congratulate my brother, Dr. Abdullahi Jibril. Congratulations. Why am I congratulating him? All of us seated here, we form the first 5% privileged citizens in Nigeria. We've all worked, we've all gone to school, we had careers. When you finish your career, when you retire, the key things you should do to give back to the society is to go back to your community and lead your community to get better. Dr. Abdullahi is doing that in our community in Lafiagi. The next thing every one of us, all of us, should do is use that experience you've acquired by that privilege that God gave you to share knowledge, your experience, bring it to the conversation on the table so that generations coming, we have something to learn from. You can add value to the society. He's doing that as a retired head professional. Thank you very much for doing that. Now, I will argue that better health begins with trust. Indeed, better everything begins with trust. Better marriage, better politics, better economy, better anything starts with what? Trust. Look, most of us who are health professionals here, our experiences has been strengthening health system. What do we do? Human resource for health financing, the health infrastructure, name it. But maybe it's about time we began to pay more attention of a component of a health system that will make it function, which is what? Trust. We need to renew the trust of patients, particularly, to have trust in our healthcare system so that the society can benefit the best from that system. Because, like I always argue, the only way to develop a society is to focus on healthcare and education fundamentally. Those two will prepare the society, and by the grace of God, we'll move forward in Nigeria. Thank you very much.
Thank you very much, sir. Let's put our hands together for Senator Sadiq. Thank you. Thank you for making it brief and short. Trust is all we need in our society. Thank you. Now, to just have one more person to speak from the regulatory sector, I'll just call on Hajia Wasilat Giwa, the Chairman, Pharmaceutical Council of Nigeria. Let's put our hands together for her as she comes to give a goodwill message on behalf of the regulator. Let's put hands together for her, please. Thank you. Okay, let's keep clapping. Thank you. All right. Thank you.
Awuzubillahi minash-shaytanir-rajim. Bismillahir-rahmanir-rahim. I want to stand on all existing protocol, but with high regard to our Royal Highnesses here. I just have a couple of minutes. One thing about this gathering, it's a gathering of hope, and it's a gathering of trust. Because I know most people that are here because of the trust that they have in the author of this book. Am I correct? I also want to underscore the point that Dr. Abdullahi, the author of this book, has been a very committed, conscientious individual that I have worked with. The journey of this ambition didn't just start overnight. I worked with him at the National Primary Health Care Development Agency. But that is a man you can give an assignment to, you can trust him, and that he will deliver. The popular meat service scheme that we launched some 19 years back or 18 years back, he was the arrowhead of the program. And that was a program, you can understand his ambition to go straight to the community where the problems are. He has always been a pioneer and a champion of good health for all in Nigeria. So I want to let you know that doctors don't work alone. You work together with nurses, pharmacists, lab scientists, and all of us. The trust cannot be accomplished if we, all health professionals, don't come together to understand and analyze the problem the way it is, right at the grassroots. And we ourselves will reaffirm that the commitment to be truthful to the service of our people will be primary in our hearts. And this campaign, we want to make it go round, even to those people who are not here. The trust we are talking about is all about the personnel at the service level. They are the people that can give you the best of trust, because when you go there at the point of entrance to the hospital, you can't find anybody smiling at you or even answering your questions as to where you go next. We need to address all that. That is a lack of trust in the system. And you get to, the laboratory or the pharmacy point, any point at all, the kind of reception you get determines the trust and the confidence, the patient will have on that system. So I want to finally say Dr. Jibril Abdullahi, that is a good work you have done. And it shouldn't stop from there. I'm sure this is phase 1 of your project. I want you to continue to follow it up to the higher level, that what you desire from this project is achieved, inshallah. Congratulations.
Thank you very much. Well, let's put our hands together for her, please. Thank you. Thank you. Thank you. Distinguished guests, Your Excellency, the Honorable Minister here represented, Your Royal Highnesses, distinguished guests, ladies and gentlemen. Before we have the chairman's opening remark, we have this short documentary, just about 2 to 3 minutes, which we just wanted to just let you see the faces, the facilities, and the facts that make Trust Renewal urgent. So this short documentary is not an entertainment, it is an evidence. As the saying goes, seeing is believing. Are we ready? Can we just roll this short 2-3 minutes short documentary for all to see? Integrity, call for a better health. Trust Renewal. Are we ready? Can we just roll it, please? Okay, we want to also acknowledge the presence in our midst. Professor Mohammed Samba is the National Health Insurance Authority of the National Health Insurance Authority. Professor, you are welcome. Thank you. Please roll the short documentary.
In our lifetime, whoever we are, we all walk the patient path, sometimes in strength, but sometimes in vulnerability. For many Nigerians, this path is often uncertain. Moments of care are sometimes met with delays, silence, or loss of trust.
Better health begins with trust. Health systems do not simply thrive because of infrastructure, technologies, policies, or legal framework. They succeed or fail along patients' path. Trust is the foundation of better health for all. It is only when people trust the health system that they will use healthcare. That is why this book, Trust Renewal, the integrity call for better health for all, is a call to action. From patients' lived experiences across the country, it reveals how integrity shapes care and how restoring integrity can transform the health systems. Better health begins with trust. And restoring that trust is a collective responsibility.
Join the movement to renew trust in our health care system.
Thank you. Let's put our hands together. Let's all join the movement to renew trust in our healthcare system. A bigger round of applause for those who put that short documentary together. Your Excellency, the representative of the Minister of Health, Your Royal Highnesses, distinguished guests, ladies and gentlemen. After what we have just seen, we need leadership that can turn emotion into action. And that is why we have the honor to have in our midst the representative of the governor of Kwara State, who is here as the chairman. That is talking about Honorable Mukhtar Tolani Shagaya. He was a member of the House of Representatives. Is coming here to give the governor's chairman's remark. Let's put our hands together for him, please. Thank you. A bigger round of applause for him. All right.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Our royal fathers here present, distinguished senators, let me recognize distinguished Senator Sadiq Umar, distinguished Senator Oluri Egbe, representatives of honorable ministers here present, the SA to the President on Health, key stakeholders in our health sector, distinguished guests, ladies and gentlemen. Kindly allow me to stand on the very well-established protocols. It is my honor to stand before you as the representative of His Excellency, Governor Abdurrahman Abdulrazak, CON of Kwara State, and the chairman of the Nigeria Governors Forum. He sends his warmest congratulations to Dr. Abdullahi and regrets that pressing official engagements prevent his personal attendance at this auspicious occasion. He has, however, asked me to convey his full solidarity with everything this book represents. So I'll go into his remarks. It gives me great pleasure to welcome you all to this landmark event, the launch of the book Trust Renewal, the integrity call for better health for all. Today is not just about unveiling a book, it is about a conversation, a necessary and timely conversation on the future of our health system and the place of trust in shaping that future. I warmly commend the author, Dr. Abdullahi, for his courage and clarity in bringing this issue to the forefront. In a time when we often focus on infrastructure, equipment, and financing, this work reminds us of something deeper, something more fundamental, the human experience of care. At some point in our lives, each of us becomes a patient or stands beside someone we love on that journey. In those moments, what we seek is not only treatment, but reassurance. Not only medicine, but confidence. And not only care, but integrity and dignity. And at the heart of all of these expectations lies one simple but powerful element: trust. Trust determines whether a mother brings her child early to a health facility or delays care. It determines whether a patient follows medical advice or turns elsewhere. It shapes how communities perceive the system that is meant to serve them. Without trust, even the strongest systems begin to weaken. With trust, even limited resources can deliver meaningful impact. What this book does so well is to move us beyond the technical dimensions of healthcare and draw our attention to the moral and governance foundations of the system. It reminds us that accountability is not an abstract principle. It is experienced at the bedside. Transparency is not a policy statement. It is reflected in everyday interactions. Integrity is not a slogan. It is the difference between confidence and doubt. These are the issues that shape the real experience of care. This conversation comes at a critical time in our country. As we pursue reforms under initiatives such as the sector-wide approach and the Nigeria Health Sector Renewal Investment Initiative, we have an opportunity, not just to improve systems, but to rebuild confidence in those systems. We must ask ourselves, Are our services responsive to the people we serve? Do patients feel heard, respected, and protected? Can we say with confidence that our systems inspire trust? These are the questions that will define the success of our reforms. As chairman of the Nigeria Governors Forum, I am deeply aware that states play a central role in shaping health outcomes. At the subnational level, we are closest to the people. We see their realities, their challenges, and their expectations. This places a responsibility on us to strengthen primary healthcare as the true foundation of the system, ensure equitable access, especially for underserved communities, promote accountability in how services are delivered, build systems that people not only use, but trust. In Kwara State, we remain committed to building a health system that reflects these values, one that is people-centered, responsive, and grounded in integrity. Restoring trust is not only the responsibility of government alone. It calls for a collective effort from health professionals who uphold the ethics of their calling, from institutions that enforce standards and accountability, from communities who engage and speak up, from partners who support and strengthen the system. Trust is built in small moments, but its impact is far-reaching. As we launch this important work today, I encourage all of us not just to read it, but to reflect on it, and more importantly, to act on it. Let this be the beginning of deeper engagement, stronger accountability, and renewed commitment to the building a health system that truly serves the people. On behalf of the people and government of Kwara State, I welcome you all, and I wish you a very successful and impactful event. Thank you, and God bless.
Thank you very much, the representative of His Excellency. Let's put our hands together. We need to reflect and act on it. Thank you so much, sir, the representative of His Excellency. Thank you for that chairman's remark. Thank you. All right. Your Excellencies, the representative of His Excellency, representative of the Minister, Your Royal Highnesses, distinguished members of the National Assembly, ladies and gentlemen. The moment is here, the moment that a manuscript becomes a movement. That is the unveiling of the Trust Renewal. May I please respectfully invite to the stage once again the representative of His Excellency, also the representative of the Minister. Please come to the stage for the unveiling. Your Royal Highnesses, please, can you please? Yes, please. The author, please. Then the author, please. Special advisor, please, man. Can you please join? Yes, our special guest, please, Dr. Senator, please, let's come. Yes, for the unveiling of the book, Hajia Giwa. Yes. Senator Sadiq, please. Okay. The chairman of the local government, please come. Before he sends you out of the local government. It's there. The unveiling is there, the book will be there. So the unveiling is there, sir. Yes. Yes. The representative of the governor, please lead there. That's the unveiling. Yes, the unveiling is there. Are we ready? Royal Highnesses, please. Yes. All right. Are we set? So on the count of 3, On the count, okay, all right. On the count of 3, we birth a new standard for Nigeria's health conversation. I'm going to start from 3 down to 1. So, are we ready? Okay, can we just... Oh, okay, it's at the edge. Oh. Can we just manage it so that we don't disrupt? Yes, just bear with us. All right. So are we ready? So on the count of 3, we'll birth a new standard for Nigeria's health conversation. I'm going to start from 3 down to 1. So let me start. 3, 2, 1. The Trust Renewal Unveil. It is done. Please remain for a group photograph. Let's have a group photograph. The picture is New Face of Health Accountability. The face of health accountability in Nigeria. Okay, can we just move to this side of the book launch, where the books are, so that we can have a better, yes, where the books are, so we can have a better picture. Yes, we start with the, yes. Yes, yes. Your Excellency, Royal Highnesses, please. Okay. Can you move it here as well? Can you move this? Can you bring it here as well? Just take the pictures. Sorry. It's covering. Okay, bring it back here. Bring it back here. Bring it back. No. Bring it here. Just, yes. We have unveiled already. No, bring it here. Down to the, where you, okay.
What are the books now? Oh, okay, thank you, sir.
Are we ready? Can we hold the book? Photographers. Yes. Yes. The author in the middle. The middle. All right. Okay. Are we set? Photographer, please. Integrity, call for better health for all. Trust Renewal, a movement. Oh, okay. Is the author's wife, is she around? Oh, please, madam, please. Please come. Please don't. The author must eat tonight or else. Wahala day. Apology, madam. In fact, that is the real author is coming. Let's put our hands together for the real author. That is the number 1 author of the book. Yes, that's the real author. Madam, you're welcome. Please take your place. Yes. Thank you for being so supportive. Behind every successful man, in fact, the women say they are not starting behind again, they are standing in front. In front of every successful man is a woman. All right. All right, can we take the pictures? All right, 3, 4, 2, 1, snap. Trust Renewal. Thank you. Your Excellency, Royal Fathers, thank you so much. Thank you. All right, thank you.
Where is that? No, the chief launcher. Adoke representative. Who is representative? You didn't come in. Please, who is representative? He was here.
Thank you. Yes. Thank you, thank you, thank you. Thank you all. Thank you. Thank you. It is finally done. It is finally done. Trust Renewal, the integrity call for a better health for all, is now before the nation. Ideas are cheap. Can we please have our seat, please? Thank you, so that we can quickly round up this gathering. Ideas are cheap. Execution is everything. And execution needs support. So to lead us in the launching of this book into the hands of Nigerians, I present to you our chief launcher for today, a man who knows the law and the letter of integrity. That's talking about Mohammed Bello Adoke, SAN, former Attorney General of the Federation. He was here earlier, but he had to leave, so he will be represented by Mohammed Imam. Let's put our hands together for Mohammed Imam. He's representing Adoke, the former Attorney General. Let's put our hands together as he comes forward for the launching of the book. Thank you.
Thank you very much.
All right.
Good afternoon, everyone. And please allow me to adopt the existing protocol. I'm here representing the chief launcher in person of Mohammed Bello Adoke, the former Attorney General and Minister of Justice of Federal Ministry of Federal Republic of Nigeria. He has written a small speech, and please permit me to read it. This event holds a special meaning to me. It is a moment where ink meets purpose, and a life of conviction finds voice in print. I stand before you with great pride and warm admiration to celebrate Dr. Abdullahi Jibril Mohammed on the presentation of his remarkable book titled Trust Renewal, the integrity call for better health for all. You will agree that this is not merely a book launch, it is the unveiling of a lifelong philosophy, a call carved with experience, discipline, and an unwavering belief that systems can be better, if only we dare to make them so. Distinguished ladies and gentlemen, trying to find their footing. Even then, Abdullahi stood apart. His brilliance was not loud or boastful, it was steady, deliberate, almost surgical in its precision. You could tell he wasn't just learning. He was understanding, and more importantly, he was questioning. I can attest that the same intellectual fire has not dimmed. It has matured. It has taken shape in boardrooms, policy spaces, and now within the pages of this timely publication. As a CEO of the Initiative for Health Accountability and Transparency, he has chosen a path that is not easy, holding systems accountable in a world that often rewards silence. That takes courage, the kind of courage that doesn't trend but transforms. This seminal work has arrived at a moment when trust, especially in health systems, is fragile, stretched thin by inequities, inefficiencies, and at times indifference. As you all know, once trust is broken, it does not respond to slogans. It responds to integrity. And that is exactly what this work demands: an honest reckoning and a bold reset. Abdullahi is not just diagnosing a problem, he's prescribing enduring solutions for the future. one where transparency is not optional, accountability is not negotiable, and health is not a privilege reserved for the fortunate few. As someone who has watched his journey from those early days, I can say this without hesitation. This moment is earned. As every page of this book carries the weight of discipline, the imprint of intellect, and the signature of a man who has refused to settle for mediocrity. May this work travel far beyond this launch. May it serve conversations, inspire bold reforms, and ignite a new generation of leaders who understand that integrity is not a decorative virtue. It is the foundation of everything that works. Congratulations, my brother, my classmate, and now a voice the world needs to hear. The boy we knew has become the man we admire, and the impact is only just beginning. I thank you for your attention. Signed by Mr. Mohammed Bello Adoke, CFR, SAN, FCIB, ARB. Now, in furtherance to that, on his instruction, I'd like to say that he has launched this book with an undisclosed amount of money which has been communicated to the author. Thank you so much.
Thank you very much, the Chief Launcher. Let's put our hands together for the Chief Launcher. Thank you. Thank you so much. Now, can we just regulate that a bit? All right. Where's the, okay. Well, it's well regulated. Now, I just want to call on our special launchers. There will be special launchers here. It's talking about the institutional launchers, community launchers. And as your name is called, please, you can raise your hand if you want to announce your, the launch or your donation. You can just, a piece of paper is being passed across by the ushers. Just write whatever you want to launch the book with. Ushers are on standby. Please collect the piece of paper. If you want us to announce, we would announce. Please, let's promote this book. Little drops of water, they say, make a mighty ocean. So every launch today sends this book into more hospitals, one more schools, and to our policy rooms. So let us do the needful. Thank you. Are the ushers there? Just pass. You can pass the paper and let them write. Do we have anybody who wants to make announcements? You want to announce your donation? You want to give support to the launch? Anyone, institutional representative, medical elders, you want to say something concerning this launch? You want to help push this book to the society, to the hospitals, to the schools, to policy rooms? Well, anyway, I know we are all being, all right. Do we all have the piece of paper? Okay, okay. We have the piece of paper, okay. Let me, okay. 1, 2. Institutional launchers, yes. We don't have all their names. The royal fathers. Maybe we want to give them the mic. Do we have the other mic? Who just took the other mic now? Maybe we just start from the front row. Where's the other mic, please? Somebody just took the mic now. Your Royal Highnesses, you want to say something concerning the launch? Okay, all right. Sir? Okay. Oh. Representative of the minister, you want to announce your donation? Okay. Okay, maybe we'll just keep it. Oh, okay. Yes. Please come forward, sir. As you come forward, just tell us. Yes, okay, thank you. Please come forward, sir. Yeah. Your name, sir?
My name is
Yes. Let's put our hands together. All right. Thank you, sir.
Your Excellencies, our royal fathers, all protocols duly observed. I want to start by congratulating my brother, Dr. MJ Abdullahi. Dr. Abdullahi is a very passionate community leader. He is very passionate about public sector governance. And most times when we engage in discussions, these are the kind of things he's always expounding. And I'm happy today that one of his jobs, because I know this is just one in a series of jobs to come out, is being unveiled today. I'm particularly happy that today is not just about unveiling a book, it's also about a conversation which has opened our eyes to the fact that it is not just about how much we spend on public sector infrastructure. There is also the soft infrastructure that is needed to achieve our goals. And I want to be in line with what our Royal Father has said. His Royal Highness, the Elder of Shishonga. I think this is the time to also look at our national orientation. Because the issue of trust is an important matter that cuts across all sectors, not just about health. So, and that is the more reason why I think this is opening up a new conversation. So once again, I will congratulate my brother, and I want to support the book launch by buying 4 of the books for 250,000 naira each. Thank you.
Thank you very much, Mr. Audu, for being very supportive. Maybe we just take one more, then we'll. Okay. Please, can you bring the mic here? Yes. Thank you. Thank you. Thank you, everyone, for being very supportive. Yes. Yes, please come. Tell us your name, please.
Sorry, good morning, all.
Good afternoon.
Dr. Abakar Kulfi.
Okay.
I'm the Director of Planning Research and Statistics in the NHIA. I also represent the DG NHIA in this important meeting. So I will speak on 2 fronts. As an individual who has interacted with Dr. Abdullahi for long, and I know the impact of engaging with this man has been on my life. Dr. Abdullahi has been a father to me, has been someone who has actually mentored, guided, and supported me throughout my trajectory of my public health life. So as a person, of my own self and of my family, his wife is also a mother who have always supported. So I want to launch it, my own self, 1 copy for 200,000.
Thank you. Thank you.
The DG NHIA has also asked that we purchase 20 copies for our library for the sum of 1 million.
Wow, thank you so much. Thank you thank you for being very supportive. Maybe we'll just take one more because of time. Just raise your hand, you want to speak? Okay, please, yes. Because of time, we still have the panel discussion. Oh.
Thank you so very much,
Okay.
Mr. Moderator. My name is Dr. Oluwatoyin Taudidin Alabi. I'm pleased to be in this August gathering this morning.
Okay.
Dr.
Glory.
250,000. When I was to do one of this person. We are looking at somebody that can do justice to health, especially primary health and primary level. And there was a consensus on who will do justice to that. All the names suggested, no other person stand out like Dr. MD Abdullahi.
A big of
was done
wow.
to ensure that we brought him down to the Trust Government Banquet Hall, and he came, he did justice to it. In fact, what is submitted as a paper become a blueprint for a glorious future for health development for Kwara State. And we are taking it to heart and want to ensure that the good work we have started continue. The books I have paid for, I have bought, but there are copies I will buy for my friends and I will still take around, because good health for Nigeria starts from today and starts from today.
Thank you. Thank you. Thank you for that encouragement. Thank you all for being supportive. Okay, the last person, because of time, we already have some donors. And please, the ushers, please go move around and collect. Yes.
My name is Abdullahi Jibril Mohammed. I'm the minor of Sarikanda, and at the same time, chairman that Descendant Development Union from that's Ilorin branch. Dr. Abdullahi has been our Ladu president all over the world. He is our president, very loaded. He's highly loaded. We know him very well, and he has been doing wonderfully well.
Is he loaded with knowledge or money?
Everything.
Let's load the load now.
Everything, even development.
Okay.
Thank you so much. So we want to launch it from our branch, the sum of 100,000 naira.
Okay, thank you so much. Thank you. Doctor, you are loaded. All right, it's noted. All right, please, can you bring the mic to Hajia? Okay, please. All right.
Good afternoon, distinguished fathers and elders. My name is Dr. Goodwill Mohammed from the Justice Commission. We have been working with Dr. Abdullahi in a lot of health matters, especially on the community targeted health insurance program. This is a social health insurance program for the vulnerable. He's the lead consultant, and honestly, sometimes we forget whether he's a consultant or the lead staff in the department, because he calls, he will send you inputs, middle of the night, I will be like, what can I answer only? That's just to show the passion that he has in driving integrity and improving access to care, especially for the vulnerable. We see this as the senior colleague here mentioned. This is not just a book, it's a reform to improving health access. And we plan to have it in all our state offices across the region.
Wow.
We have it in our head office.
That's good.
We have it in our liaison offices.
Awesome.
And it's going to be it states that we work with, that's across the whole of the Northeast. So it's a form of like a meeting point, a guide for how we take up our health reforms in our states. This he knows, his family. We don't have to disclose the amount, but it's going to be a very good one.
Okay, okay. That's in the millions, in the millions. Let's put our hands together. Thank you for that resounding support. Fantastic testimonies concerning Dr. Abdullahi. We have more people, yes, please. Just raise your hand, and the ushers are there. Yes, please, the gentleman in blue, thank you. Thank you, sir. Please, let's know you, sir.
أعوذ بالله من الشيطان الرجيم
Yes.
My name is Abubakar Jimmy Danjuma, a very close friend to Dr. Abdullahi. Dating back to, can I say, 1985.
Wow.
That's a long time now, it's like we get. Dr. Abdullahi that I know, very tall and outspoken. I'm happy to be a part of it today because of the person Dr. Abdullahi Jibril is. On my own, as a retired person, I'm going to buy a copy of this book for 50,000 naira.
Wow.
Thank you very much.
Thank you. A pensioner. Thank you. Pensioners have money in this country. Let's put our hands together. More pensioners, please. We know a lot of pensioners are here. Oh, you are your own. Oh, sorry. Oh, he's still in the business. Okay. I thought, some of us are just, all right. Do we have more people? Senator Ibrahim Oloriegbe has bought 4 copies for 250,000 naira. Let's put our hands together for our Honorable Senator. Thank you so much, sir, for the support. And Dr. Kufil DG NHIA, 20 copies for 1 million. Let's put our hands together. Thank you so much. Then we have this Ladu Abuja branch, 5 copies for 100,000 naira. Thank you so much. Thank you. Let the money keep coming. Yes, they can make pledges, donations, little drops of water. We'll push this book to the community, to the schools, to the hospitals, to policy rooms, governments, parastatals, MDAs. All right, do we have more people? Yes, please. The ushers are around, please. Okay, there's somebody at the back, please. The gentleman with the shirts. Please come forward, sir. Thank you, sir. Let's see your face. People want to see your face. Yes. Yeah. Please take the mic. Thank you.
Good afternoon, ladies and gentlemen.
Good afternoon, sir.
I'm here on my personal capacity.
All right, sir.
I'm also representing Health Sector Reform Coalition.
Okay.
I'm making a personal coffee purchase of 100,000 naira.
Wow. Thank you. Bigger round of applause, please. Thank you, sir.
MJ Abdullahi is also my friend. Since he left government, we've been consultants together.
Okay.
Most of the clean times we do in his private office. So this book is a reflection of most of the collections and critiques we have done together.
Okay.
I'm very happy for him and I'm very proud of him.
Thank you, sir. You didn't introduce yourself to us, sir. Can you introduce yourself to us?
Dr. John.
Okay. Thank you, Dr. John. Thank you so much for being supportive. Do you have more people? Yes. Okay. This one is coming from Ladu Lagos branch, and they are buying 5 copies for 500,000 naira. Let's put our hands together. Thank you. Okay. Good afternoon, sir.
We are Dr. Abdullahi from Prime Resort Estate, opposite James Village. Dr. Abdullahi has been a very good leader. He has been assisting the estate in all aspects of life, health, religious-wise, economic-wise, in terms of repairs of infrastructure within our
Wow. Thank you so much. Thank you, sir.
On behalf of myself, buy 2 copies at the cost of 50,000 naira.
Okay. Thank you. Thank you.
Also, some members of our estate, Abdullahi is also buying 2 copies at the cost of 50,000.
Thank you. Yes. Please, the ushers, be noting all these announcements. Thank you. Thank you. Thank you. Thank you for being supportive. Thank you. God bless you. Thank you. Do we have more people? Then we have this Mohammed. Okay.
My name is Engineer Abdullahi Mohammed.
Okay.
Here, working with a real estate company, Goodwill Concept Limited, here with my managing director. Dr. Abdullahi is like a father to me. I used to look up to him when anytime I think of the community development. He has done a lot from the grassroots. May God bless you and reward you for that. On behalf of myself and Goodwill Concept Limited, I want to launch some 2 copies for sum of 100,000 naira.
Thank you. Thank you. Real estate. That's big money. Oh. Maybe you should increase that, your donation. Okay, please come forward here. Okay, please come forward. Sarah. Yeah, okay, thank you. Thank you for your support. We have Muhammad Ndagi and family buying 10 copies for 100,000 naira. And we have Hajia Wasilat Giwa, 1 copy for 100,000. And Dr. Isa Vatsa, 1 copy for 50,000 naira. And Dr. Ngozi Nwosu for 2 copies for 50,000 naira. Please, go ahead, sir.
Dr. Ibrahim Jibril Mohammed. I'm the National Vice President 1 of the Descendant Development Union. Incidentally, the author of Trust Renewal is the National President. The NEC has directed me, has authorized me to buy a copy of this very, very would be powerful book for 100,000 naira.
Wow. Thank you so much, sir. Thank you. Thank you for that announcement. Thank you. Do we have more? Because of time, we need to move on. So if you have your donation on the slips, please just write your donation and the ushers will collect. And if you want to make immediate payment, you can ask the ushers. They will give you the account. And also, there is POS where you can do immediate transfer. You know, technology has made transfer of money very easy now. You don't have to postpone till tomorrow. You can just do your pledges today. So just get the account details from the ushers. And if it's POS you want to use, the ushers are there with the POS and your money will be remitted. Let's move forward. Let's put our hands together for ourselves. Thank you, and thank you. Now, we have been talking about the problem in the health sector. Now it's time for us to talk through. We need to talk through the solution. So for the next 20 to 25 minutes, we're going to shift from monologue to dialogue. And returning trust in health system, setting agenda for integrity and accountability. Now, to chair this panel session, we have the Special Advisor to the President on Health, Dr. Salma Anas Ibrahim, who is supposed to moderate. She is, okay. Who is supposed to be the chairman. The moderator will be Dr. Gafar Alawode. Let's put our hands together for Dr. Gafar Alawode. A bigger round of applause for him, please. Okay. I'll now hand over to Dr. Gafar Alawode. Let's put our hands together for him, please.
It's working. We can use this.
Good afternoon, ladies and gentlemen. Special greetings to our royal fathers. Please permit me to stand up with the existing protocol because our time is fast spent. I would like to crave your indulgence. We are going to have just 30 minutes of a conversation around this very important thing. To do justice to this conversation, I would like to call our panelists. One house, please. One house. Thank you very much. So we have one of our panelists, is Dr. Agada from NHIA. We have other panelists. We have Ebenezer Ogwantu. We have Olumide Okunla joining virtually. We have the representative of Nursing and Midwifery Council. Dr. Sample, that's a very unique name. Can we please come up? And other panelists as well. So we're just going to have a quick conversation. Ebenezer, I've already called you. Come up the stage to have this conversation. Can somebody check whether Olumide is online to join? Dr. Agada, please come up on stage. Yeah, please, you can just sit down here. Okay, madam, can you move closer? Okay, great. Okay, thank you very much. Once again, welcome to this conversation. I would like to start by acknowledging the importance of this conversation. For me, there are a couple of reasons why this is extremely important to me personally. One, 20 years ago when I returned to Nigeria from the UK after my master's, I was contemplating whether to stay back or to Japa. Japa was not in vogue then. But the first person that I interacted with from the one house, please, thank you. Let's demonstrate trust in the system. Thank you very much. As I was saying, my first encounter with any policymaker in Nigeria was Dr. Abdullahi, who actually convinced me and took me through about Nigerian system that was not as bad as I thought. And that changed my mind. And for the past 20 years, I've been working here, and then from what I've done, I learned to trust him that what he told me then was the truth. Then secondly, somebody said, we don't trust a system for two reasons. We don't trust a system, or we don't trust people for two reasons. One, we don't trust somebody because we don't know them. But interestingly, second, we don't trust people because we know them. And you now discover that when you are not trusted because you are not known, it's a lot better than when you are not trusted because you are known. Because for the first one, it's very, very easy to redeem your image. But the second one, you are already known. And that is why this book is very, very important. It's talking about trust renewed. And that is why we are going to be having this conversation. Now, I would like to start with an agency that is saddled with responsibility. Hello, one house, please. One house, please. Thank you very much. Thank you very much. One house, thank you very much. Exactly. Can we please reduce the movements in honor of the author, please, if we don't want to honor any other person? Let's reduce the movement. Let's remain seated, please. Thank you very much. Thank you very much, Mr. Adeoye. As I was saying, we are going to start with the agency of government that's saddled with the responsibility of engendering trust between the citizen and the service provider. So I will go to Servicom and try to find out, Madam Neka, you have listened to speakers after speaker. The issue of trust deficit is palpable in Nigerian health system. What is Servicom doing to ensure that we are going to, breach this trust deficit, to ensure that we're able to engender trust between the consumer of services and the producer? Madam.
So thank you, Mr. Moderator, for the opportunity. Thank you, Dr. Abdullahi, and congratulations on your beautiful work. So from the Servicom point of view, there are two essential components in service delivery: the service provider and the service recipient. So for Servicom, what we advocate and what we go about preaching is there is need to bridge that gap. How do we bridge that gap? By ensuring that not only do government institutions, in this instance, healthcare institutions or hospitals, deliver on promises, but that they are able to put promises, standards together in what we call the service charter. The service charter is a document, a promissory document from healthcare institutions, and indeed most government institutions have this service charter. It spells out the standards you propose to your recipients of services. In healthcare institutions is the patients. It spells out standards, it spells out time standards, service delivery standards, payment standards, and the like. Information standards: what time do hospitals open to patients? It spells out how long it takes for services to be rendered to patients. And essentially, we hold institutions of government accountable when these services fail. Servicom is present in all federal institutions, especially in our teaching hospitals, federal medical centers, and the like. So what this book is doing is to reinforce what Servicom essentially is saying, that these services and standards that are in government, that are out there, should be strengthened for members of the public to receive the best care out there. And we also advocate that you do not promise what you cannot deliver on. So if there are gaps within your systems and you have identified this, you propose standards within the gaps you have in your institutions. So, and when these services fail, there are need for redresses, and we propose that every institution has a redress mechanism such that when people are aggrieved, when people feel shortchanged by services, they can speak to somebody at the Servicom desk in the institution in order to get redress for their complaints. So that is what we propose at Servicom office. Thank you.
Okay, thank you very much, Madam, for that succinct description of what Servicom does to promote trust. Emmanuel, let me come to you. You look at things from the medical point of view, from rights point of view. We've heard about service charter, standard, and all those stuff. How do we look at the issue of trust from the right of the patient as well?
Okay. Thank you very much. Let me also join the numerous voices that have commended Dr. Abdullahi. When we had a discussion concerning this project, because for me it is a project, this is just the foundation. We are yet to start building. This is more like the blueprint. It is from here, this is the design. From here we begin to build. So when we had conversation, we identified too many gaps that need to be filled. So from the rights perspective, the major gap is lack of awareness. What are we not aware of? On the part of the patients, they do not know their rights. On the part of the healthcare professionals or providers, they do not know how to implement the respect for the patient, for the rights of the patients. A few of them are aware of the rights. Yes, the Patient's Bill of Rights is there. The National Health Act is there. What does it say? If you look at the Patient's Bill of Rights, rights to maybe informed consent, what is informed consent? Starting with the most important right to information. Section 23 of the National Health Act says a patient has a right to information. What information are we looking at here? Information as to the nature of the ailment. One, information as to the probable side, the treatment options available. Information as to the probable side effects. Information as to the cost implication. And most importantly, or two, one is your right as a patient to decline the treatment. Again, that this information should be relayed to the patient as much as possible in the language the patient understands. If a patient presents with anemia, for example, and you say, "Madam, you are anemic," you have said nothing. She does not understand the meaning of anemic until you break it down for her to understand. That's her right. Unfortunately, we do not observe these rights. Where a patient asks some question that needs explanation, you get a reactionary response. Are you here to teach me my job? When we talk about consent, the consent should be informed. But what we have is 3, 4, 10 minutes to wheeling the patient into the theater for a procedure. You say, "Madam, sign here." The woman will sign, but she does not know what she's signing. If anything goes wrong and the woman comes to court and under cross-examination, it is established that she was just told to sign and she signed, the court will invalidate that consent. So the challenge is there is a knowledge gap. How do we fill that knowledge gap? Aggressive but precise education on the rights of patients, both on the part of the healthcare professionals and the patients themselves. But this awareness must be carried out in our local languages. The example I usually give is this. Election is around the corner. Soon we will start hearing jingles. Good thing, National Orientation Agency has been mentioned again and again, and I usually make reference to them. Elections are around the corner. You will hear jingles: do not engage in vote buying, do not engage in ballot snatching, do not engage in this and that. We have been hearing jingles: do not engage in bush burning, do not engage in vandalization of government properties. I want to ask all of us here sincerely, how many of us have heard any jingle telling us that there is a law or a regulation called Patient's Bill of Rights, and these are your rights as a patient, in our local language? Because that's where the gap is. Today we have launched this book. After now, what next? So that's my submission on that. Thank you.
Very, very powerful. Thank you very much. And knowledge gap, education gap in terms of the rights of patients is very, very critical for us to bridge the gap. So let me go to medical. I keep saying medical. Nursing and Midwifery Council. Sorry, that's my primary constituency. Sorry. The Nursing and Midwifery Council, from the regulatory point of view, how do we engender trust because the council oversees the education, nursing education profession, from the path, how do we engender trust?
Thank you, the moderator. Good afternoon, our royal fathers. Good afternoon, Dr. Abdullahi. I want to appreciate you for this great work you have done. I am here representing my registrar from the Nursing and Midwifery Council of Nigeria. I want to really appreciate you for honoring me to be in this gathering. As we all know, trust in healthcare is built on competence, integrity, and accountability. Speaking from the regulatory aspect, from the Nursing and Midwifery Council of Nigeria, we all know that we are scheduled with the responsibility of maintaining standards in nursing education and practice. So as a council, one of our responsibilities is to make sure that healthcare providers are not only maintaining standards, but when those standards are breached,
there are consequences. Thank you.
Okay, thank you very much. Ensuring that we have standards for service provision and ensuring that when the standard is not met, there are consequences that will actually encourage that standard. Let me go to the Dr. Agada for health insurance. If there is one area where trust is extremely crucial, is in how, why you are trying to ensure that people embrace health insurance. So, Dr. Agada, in the last few years, we've seen improvement in enrollment as from the data from NHIA. So what is the element of trust that you are incorporating into your strategy?
Thank you very much, moderator, and thank you all for your time and for having me here. Just to say that in looking at trust, and trust has been severally defined here, but to say that from my point of view, trust is a currency to which healthcare business is transacted. If there's no trust, you don't really have the hardwares of the health systems working. So there are several softwares for health system. Trust is a key one, but once that trust is broken, you do not make progress. I wanted to talk about trust looking at the three key aspects of health from another framework. When you're talking about the supply side, the demand side, you have asked that I talk about the demand side, which is health insurance. At NHIA, we are not just interested in people enrolling, but we are interested in people buying health insurance policy and getting to the hospital and being able to access care. So that is very important to us. And beyond that, there is the issue of quality of care, which is also key. So building trust means that when you buy health insurance, when you go to the hospital, you should be able to access care, one. Then number two, there's nothing as important as that issue of person-to-person discussions around what your experiences are, patient's feedback. And so we look at it that when you get to the hospital and you have quality care, you probably will be telling your people around you about how good the patient journey has been for you, and then more people can take up health insurance. And also, looking at citizenship. How do you use trust to mobilize citizens? And that is key. Getting people involved in designing policies for health, getting people to own policies that we design. We have the National Health Act. My colleagues here have talked about it. People must be involved. They must know about it. And that's the whole thing about health system. Health system and development of policies should not be strange to the people, because you would have carried people at the community along. And so when you deploy those things and you come, you talk about it, people already have the trust. So basically, I think that's the points that I have for now.
Okay, thank you very much, Dr. Agada. The need to be patient-centered and involving people, working with the people, came out clearly. I don't know, can somebody confirm if Olumide is there online? Okay. Olumide, can you hear us? Please confirm.
Yes, I don't know if you can hear me, but I can hear you loud and
clear. I can hear you loud and clear as well. Thank you very much, Olumide. For the purpose of introduction to you.
Dr. Gaha, please, could you, like in 30 seconds, just summarize your question?
So the question is this: going forward, when we are designing development project going forward, how do we ensure that the issue of trust is central as one of our objectives?
Thank you very much. In fact, I think the panel has already done a good job of situating trust within the healthcare system more broadly. The only thing I want to add, I would to build on what Dr. Agada mentioned in terms of, can we look at trust as a currency? Because indeed it is a currency. The foundational construct for this issue begins with how much are governments providing to finance health care. This is necessary, but it is not sufficient. If we do not, or we are unable to prioritize health care within the budget, my apologies, there really cannot be trust. That's just the bottom line. You know, I do not need to repeat the numbers in terms of how we are doing, in terms of how the federal government or state governments are either allocating financing for health, but everyone will agree that it is very low. So this is the foundation. And if we begin to then trace that, the consequences of that, it means that without resolving this at the base, then it will be very challenging. There's a second dimension to it, because trust in healthcare and financing is a two-way street. For example, in countries like Philippines, that taxes have been raised on pro-health taxes has been raised and used for healthcare. It was because the citizenry trusted the government to say, look, yes, you can increase taxes, but we will be able to see the tangible benefits. So in one way, you have a country able to will be used for the population. So again, trust is two ways. A third dimension about trust is it then also comes to when even government gives us the little it has within the sector as providers. How are we? What kind of decisions are we making with that? Because here, government has trusted us with resources, but how efficiently are we using such resources? Are we being wasteful with it? Are there leakages along the line? So quite a number of dimensions to it, but I just would like to restrict my intervention to trust and public financing. And then to close with one example. In Ghana today, you cannot take health insurance away from Ghanaians. Health insurance has become part of the conversation for health insurance that you're talking about in Ghana. Political parties are booted out of office or win elections because of their position on health insurance. That is how trust in a system can have a role much more than at the sectoral level, it being able to influence even how elections are won and lost. So this is a very big construct, but in healthcare, it has implications right across board. But in summary, clearly how governments prioritize this within their budgets is a necessary but not sufficient condition. Back to you.
Thank you very much, Olumide. That's pretty clear, bringing the perspective from health financing in terms of financing adequately, but more importantly, improving the efficiency of financing and being more intentional about engendering trust when we're spending money on health. So I'd like to ask one last set of questions, 1 minute each, because our time is fast spent. Now, we have listened to an overview, and Senator Oloriegbe did an excellent job reviewing the book, giving us the summary, the most important information provided. And again, there are posters around going forward. The world is changing, technology is changing, everything is changing. So I want to ask our panelists, what should we do differently in the context of the knowledge of this book, in the context of changing world? What should we do differently to further engender trust? Let me start with the Nursing and Midwifery Council. What should we do differently?
Thank you very much. As we've all said, trust in this gathering is like is the main word. Is the currency, yes. We said better health begins with trust. So trust is restored when systems are working well. Trust will be restored when patients sees as health workers, when we are competent, when ethical conducts are being adhered to, when there is transparency in our systems, and when there are consequences for misconduct. Thank you very much.
Thank you very much. Emmanuel, one or two things that we should, Ebenezer, one or two things that we should do differently going forward in the context of the conversation we just had today.
For me, the most important thing to do is to shift from, I'm talking to healthcare providers now, moving from paternalism to self-determination or self-determinism. Paternalism is where the doctor ignores the patient and whatever idea the patient has regarding his treatments, where the doctor makes the sole decisions. Now the doctor should begin to involve the patient, guide them. It's their body. There are decisions of court that have said the patient is the master and lord of his body. If I have a right to the point that I can decide I do not need your treatment, so the doctor should begin to respect the input of patients, lay the options available and say, take this, take this, take this, what do you think? The patient might end up referring back to you and say, doctor, you are the professional here, guide me, tell me what is in my best interest. But where you ignore the input of the patient, we will lose trust. Secondly and lastly, we need to make our system flexible. I'm going to tell a short story. A man went to court in Benue State because of 2,500 naira. Yes, it's shocking. He went to the court of what happened. The hospital had given prescription to attend to his son, and they didn't have a particular item. The man went outside and bought it. But when he was given his bill, the cost of 2,500 reflected in his bill. And the man said, no, you people didn't give me this. I bought it from outside. And they say it's our hospital policy. Now, part of the right of a patient under the patient's bill of rights, right to transparent billing. So the hospital insisted. The man went home, they detained his child, he went home, came back to pay the money and went to court because of 2005. Surprisingly and shockingly, the court of first instance agreed with the hospital. The man went to court of appeal, Benue State Makurdi Division. The court of appeal delivered judgment in his favor, ordered the hospital to return the 2,500 and pay a cost of 250,000. So if we can look at our policies and not make it rigid, if a patient asks a question, even if that had been the position, let us also engage our brain to say, this man is making sense here. If there is need to adjust, let us adjust. Thank you very much.
Great, thank you very much, Ebenezer. So let's go to Savicom. Savicom, what's Savicom going to do differently going forward to be more effective? We've heard about the charter, and other documents, the standard and everything. How do we make them to be more effective?
Okay, thank you so much, moderator. We can't overemphasize the need for engagement at every level, particularly from recipients of government services, in this instance, patients. The feedback from patients drives service improvement, no matter how inconsequential we may think their experiences are or their complaints may be. We've had the example of 2,500 naira. It's a very frustrating experience for any parent to be billed what I have paid for from outside. So we at Servicom are constantly talking about engagements through feedback, engagements through focus group discussions, engagements through surveys. You know, customers can be stratified. depending on the category of customers you may be looking at. What is your target audience? It is very important that we stratify our customers to be able to get good feedback that can drive service improvement around health sector, because in that way, we are hearing from the people and designing policies that will truly serve them and ultimately transition Nigeria for better service delivery. Thank you very much.
Okay, thank you very much. And lastly, let me go to NHI. So what would NHI do differently? 2030 is just by the corner, universal coverage targets. And trust is going to be very central. If people don't trust the system, they are not going to enroll in health insurance. So what's the NHI going to do differently to further engender trust?
Thank you very much, Dr. Gafar. You are also an expert in this field, so you know about 2030. So it's wonderful, and it's a big one. We all know what is happening in the world, where funds are drying up and donor funding is drying up. We have no option as a people. We have to do sustainable, resilience financing of the health system. And the people have to trust us. For health insurance, people will have to pay. When they pay, they have to trust. So we have to build the health insurance that is resilient and that is also engaging. The people must be engaged. They must be fully aware. Servicon was talking about charter and all that. People must know the benefit package and what they are entitled to. And once they buy into that, they should be able to demand for care, effective demand for care at the hospitals. The hospitals will have to be ready through the process of accreditation, quality assurance, and we will ensure that the quality of care that is given at the hospitals are good. And then we should go back to the people. We have to be transparent. We have to be accountable. All this will have to be built into. But for me, a very critical part is getting the voice of the people. Citizenship engagement is key. And once you do that, like I said earlier, you get the trust of the people. Let's not build in the air. As one of my colleagues was talking about doctors making decisions. Yeah, so they make decisions. But the people should also be involved. Somebody might not want injection and says, I prefer tablets. If there are options, let's have. And then people, through that and through involving people in building the policies, in implementing the policies, we are able to build trust. For health insurance, we need to be transparent about our benefit package, about what the quality care that we are talking about looks like, and about what people, time that they will spend in the hospital and things like that has to be monitored. And then finally, the feedback that we have to get from citizens is key. We must continue to review our policies based on the feedback that we get. And I think those things are critical. If we do that, our health system will move. Our health system will move to where we want to take it to. Thank you.
Okay, great. Thank you very much, Dr. Agada. I think you've listened to our panelists, and earlier on, Olumide summarized his input, so probably might not be necessary to go back to him in the interest of time. I think our panelists have done justice in the last 30, 45 minutes. What I've been hearing, one is that trust is the new currency for us to move the health system forward. Secondly, when we are talking about trust, trust everywhere, not only within the health system, because trust is the glue of life, is the foundation of every relationship. And every other relationship that we have affects health relationship. Okay, Olumide, please come in quickly.
Dr. Gafar.
Over to you, please, Olumide. Go ahead, Olumide, please. Can you hear me? Okay. The IT guys, what's happening?
Can you work on his audio?
If you want us to trust your system, make Olumide speak. Okay. Okay, apparently the technology will allow.
I just have one comment.
Please go ahead,
Look,
please.
to make trust tangible, we have to rapidly digitalize our health.
Taking advantage of technology.
I don't know if you can hear me now.
We can hear you. Go ahead. What I think the point Olumide was making is about taking advantage of technology, digitizing the system, AI, and I think we just conclude that Olumide couldn't hear us, and let's go and conclude. Yeah. So many.
Okay, if you can hear me, I just wanted to mention the role of digitalization.
Yeah, I think the point is made. The role of digitalization in terms of ensuring transparency, accountability, engaging with the patient, because part of what came out clearly is that we have to engage with the patient.
Thank you. That's the point I wanted to make.
Thank you. Engaging with the patient, not only through education, telling them what to do, but listening to them as well. The medical headers are here. There's a history around Kashioko in Ghana, the doctor that went there. Kashioko, most of us know that is a Ghanaian language. And then the thinking of the patient was different, that Kashioko is something that you just have when you have another child. But the patient did not say you are stupid. The doctor did not say you are stupid. She went to the community and found out. And that was when she was able to discover that, okay, what actually happened when you have another baby is a nutritional issue. You understand? And that is why they were able to identify it as a nutritional issue. So it's extremely important for us to listen to the patient as well, engage with them, ensuring system accountability, and to be transparent about what we're able to offer. There are instances when people started a maternal and child health, free maternal and child health program. But the citizen thought it was a free health program altogether. And when they get there, it became a trust issue. So on this note, I would like to thank our panelists, Dr. Agada, Madam Neka, Ebenezer, and Madam Adota.
We want to find out, in case you have a question for the panel, maybe one or two
questions or contribution?
Yes.
Okay, great.
Yes. Can we just, do we have a mic for?
Okay. Please, let's make it brief, and if it is a question, let's direct it to a specific panelist.
Okay. Please, can you pass this?
Question.
Maybe you change the mic. Yes, I think that. Okay, that is better.
My question goes to the Sabicom representative here. She mentioned some standards, that there are so many standards in place to make sure the health caregivers do justice to the patients. What is the health system doing to make sure on behavioral standard, because this is one thing that makes people to lose trust in the system completely, the behavior of caregivers. I can give one short example. There was a time my son was admitted to the hospital, but the caregiver, the nurse, the way she was treating the boy makes this guy, from that moment, to lose trust completely in that hospital. Whenever he's sick, and you mention that you take him to that hospital, it made me really change hospital completely. For my family, I have to check, because that guy will not go back to that hospital. If you go, you just say that wicked auntie. You can see how one person's behavior has damaged the.
Okay, that's fine. Very, very important question. It's noted. It's going to be answered.
Behavioral standard.
Behavioral standard. Great, thank you. Any other question or contribution?
So we just merge everything together.
Exactly.
Okay, just.
Okay, great.
Please make it snappy because of time.
Absolutely. And let's ensure that women are represented as well.
Good afternoon, everybody.
Yeah, good afternoon.
Please permit me to stand on the existing protocol. My question goes straight to the Savicom representative. With all due respect now, sir, what is the government putting together to make the healthcare provider to work effectively without behaving anyhow at the point of their duty?
Okay, health workers. Okay, great. I think those are the two questions that we have.
Yes,
Madam Savicom.
Okay.
I'm very sure you are equal to the task, yeah.
Okay, so thank you very much. It's beautiful to see the reactions of people. Okay, so let me start by saying you see how easily trust can be eroded. But I also want us to understand the complexity of the health sector, especially healthcare institutions. Healthcare institutions, there are so many stakeholders involved in healthcare institutions. There are doctors, there are nurses, there are medical lab scientists, there are what do you call it, concessionaires, there is the Pharmaceutical Council of Nigeria. There are so many sectors that come together in health sector and healthcare service delivery. And every sector has standards, operating procedure, they have ethical standards that they must uphold. And in that regard as well, you know, Madam from the Nursing Council of Nigeria made mention of standards that are spelled out for nurses to uphold. So they guide their practice. In Servicom, what we try to do is for healthcare institutions to also have standards they work with, standards that they put in place in order to ensure that, you know, everything works seamlessly, like opening time standards, information standards. What should I do when I do not get services? Who should I be talking to? Okay, so if it was a government facility where your son was taken to, there should be a Servicom window in that facility where you can complain that I was poorly treated, such that it triggers some form of investigation. However, what we see, sadly, is that a lot of people, Nigerians, we do not talk about our service experience. A lot of people go back pained, go back hurt, and they don't talk about it. But what we have also seen is that when you are bold enough, one person speaks, another person speaks, another person speaks, you know, and most of the time, if you're able to document this, it is seen. But when you don't talk about your complaints or challenges when you go to service, when you go to receive service, it goes unnoticed, it goes unchecked, and such that the system doesn't change. But when we are able to talk about it repeatedly, even document it and forward it, copy the Ministry of Health Servicom, copy Servicom office, you know, we keep documentation, and it leaves evidence that something is not right here, and such that we can, you know, check those, you know, service delivery gaps and address that. I hope with this summary, I have been able to address what that's your question, and to say that there are Servicom units in every healthcare institution, and such units, when you complain to them, they take notice. Document your information, document your complaints, document your concern, such that, you know, it can be investigated. Thank you very much.
So thank you very much, Madam. What I would just add to that is that it's very good that all those standards are there, but people need to know. And unless awareness is very important, and using the channel where people will know. A lot of, nowadays, in addition to traditional media, we do a lot of things on social media and everything. Even myself, when I was discussing with Dr. Abdullahi about the panelists and say Servicom, I was asking, is Servicom still in existence? And that is myself, and not to talk of probably other Nigerians. So we have to do more to ensure that it's increased awareness. So on this note, I would like to thank the audience for listening to us. I think the message is very, very clear. Trust is the currency, is the glue of life. We have to do more in terms of using rights-based approach, involving our patients as well, educating them, but listening to them as well, so that at the end of the day, we'll be able to have a patient-centered health system. Thank you very much. On this note, I would like to disband the panel, and the panel is hereby disbanded. Right?
A big round of applause for our panelists. Okay, please, a picture for them. A big round of applause for our panelists, please. Okay, the author, Alhaji Abdullahi, please come and join the panelists in this photograph. The photographers, please, can you just come? The representative of the minister, Dr. Ogbe, please join. And we don't want to trouble our royal fathers. Okay, we don't want to worry them. They have been very patient and very supportive. Thank you so much, sirs. Do we have the picture? All right, the photographers. 2, 3. After the count of 3, you just snap. Are we ready? Okay. 2, 3, 1, snap. All right, thank you so much. Let's put our hands together for our panelists. Thank you so much, sir. Thank you, Dr. Gafar. Thank you so much, sir. Thank you. Trust is the currency to move the health system forward. The need for us to speak out when we experience unholy treatment in the hospitals. Once again, we want to thank everyone, especially our royal fathers, who have been very, very, very supportive, have been able to see through these events. They've been here since a few minutes to 10, and we are still here, and they are still here. Thank you so much, sir. And to give that, the closing remarks, that is the vote of thanks. Thank you. Now, to give the vote of thanks, I'd like to call on His Royal Highness Alhaji Mohammed Kudu Kawu, the Emir of Lafiaji, Kwara State, to give the vote of thanks. Let's put our hands together for His Royal Highness. A bigger round of applause for him, please. Been very supportive, very patient with us today as our father and a leader. And thank you so much, sir. The vote of thanks, sir.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وصلى الله على نبي الكريم سيدنا محمد وعلى آله وصحبه وسلم. Your Excellencies, my colleague, distinguished ladies and gentlemen, Assalamu alaikum wa rahmatullah. Today is not just a milestone for the author, but for our entire community. We thank Allah for this day. Dr. Abdullahi, he has shared 4 decades of experience and has written for us a document that almost all the speakers here today have said is very timely, for the simple reason that he has brought to the fore a topic or a perspective that has received little or no attention. In his own words, emphasis has been on the hardwares, isn't it? The infrastructure, the quality of the doctors. But a lot of us, and I think a lot of policy makers, decision makers, are making this mistake. We forget the soft part of it, which is the feedback from the people that these things are meant for. And from even the panel discussion we have seen or heard today, it's so obvious that we have a major problem that has received little attention. So like almost every other speaker has said, we're grateful to Dr. Abdullahi, and I think, and I will encourage and appeal to all stakeholders in policy and decision making to read this book so that it will serve as a guide to so many of us. On this note, I would like to say a big thank you to all those who have supported Dr. Abdullahi to make this book a reality. Over the course of his career, he has met with so many. And I'm sure in the book, it's not just his experience, but the experience of those he has worked with. So we thank them profusely, not just on behalf of Dr. Abdullahi, but on behalf of our community as a whole, for the support that they have given to one of our very best and erstwhile sons. We thank you most sincerely, and may Allah bless you also in all that you do. I would also like to use this opportunity to say thank you to everyone that has attended this program, physically or online, and has supported to make it a reality. May Allah reward you all abundantly and bless you. And on a final note, I want to wish all those that are here journey mercies as they go back to their various destinations. I want to, at this juncture, call this program to a close. Thank you very much, and Allah bless you all. Alhamdulillah.
Thank you very much, Your Excellency. Let's put our hands together for His Excellency, our royal fathers. They've demonstrated leadership, cooperation, patience, support, love. Thank you, everyone, for being patient with us. We have come to the end of this event. Trust Renewal, the integrity call for a better health for all. The exhibition and book sales remain open. The exhibition and the book sales remain open at the foyer for another 30 minutes. Those who want to have press interview, you can have it outside. Thank you, and safe journey. God bless you all.